Hello everyone, this is Larissa Walrun for PIDP 3351 Feedback Strategies. This is my Module 1 lesson. Today we're going to talk about growth mindset for massage therapy. First, let's talk about our agenda for today. I'll go over our objectives, then there'll be a moment for stories and questions. After that, we'll do a learning activity where we can practice handshakes, mini massages, and then giving feed forward. After that, we'll have a discussion on the activity and then a quick summary. Here are our objectives for today. By the end of this lesson, you should be able to describe and identify aspects of a growth versus fixed mindset in the context of learning a new massage therapy technique, as well as then be able to transfer it to helping your clients with their potentially fixed mindset. Okay, let's take a moment and think about those clients who come into the office, into your treatment room with a really negative attitude. Let's say they've had an injury for a really long time. They've tried everything, chiropractic, physio, acupuncture, and nothing's worked. They come in and they think, okay, I guess I'll give it a shot, but I really don't think anything's ever going to change. I'm sure we've all had, as massage therapists, those clients that have that negative attitude. Now take a moment and think about clients who come in maybe with an injury, maybe just some chronic pain, and they tell you, I know you're going to help me. I'm really looking forward to this, and I know I'm going to feel better afterwards. These are the equivalents of a fixed and growth mindset in terms of massage therapy clients. I think it's really easy to see the comparison and the connection between these two mindsets. If you're going to have any kind of treatment, you know there's a potential that it won't work, but if you believe that it's going to work, you're much more likely to have a positive outcome. I've been practicing massage therapy for 17 years and I see it all the time. Clients who really truly believe that nothing's going to happen, nothing's going to help, are the ones that make no progress. Clients who are open-minded and truly believe that there's potential for change, those are the ones that have much better outcomes with their sessions. Now, I'd love to hear from you, but this is a recording. In the comments, if you can, please let me know if you can relate to this story. Okay, let's talk for a minute about feedback versus feed forward. As a massage therapist, I solicit feedback all the time from my clients about what I'm doing. Are you comfortable? How's the temperature? How's the pressure? It benefits the outcomes of the session. But if a client, like we were talking about before, has a bad attitude, I need to give them feed forward. I noticed you're thinking in terms of absolutes. If you want to get better, you need to understand the body is plastic and that you can change your body. If they don't have a growth mindset, it's unlikely that they're going to make much progress. So in terms of getting feedback, anything is fine, but in terms of giving feed forward as a massage therapist, I really need to think about the mental state of the client. Sometimes they might be depressed, and how to talk them through having more of a growth mindset and understanding the plasticity of the body so that they can have better outcomes with their sessions. Speaking simply, feed forward, you mention what's good and you talk about what could be better. So moving forward for our next activity, we're going to think about what could be good and what could be better when we practice our little handshake and our little mini massage. Okay, moving on to our activity. So if this were real life and I had actual participants, I would have everybody pair off and practice a handshake, and then just give some really simple feed forward on that handshake. If you've ever shook someone's hand, you know what it's like. Sometimes it's clammy, you can't help that. Sometimes it's kind of weak, sometimes it's too strong. So think about, okay, that was a good grip. You made eye contact, you landed your palm really well. But next time, think about changing your pressure, changing how much you're gripping or how much eye contact you're giving, or how long or how many shakes, something like that. Take turns giving each other feed forward so that you can get an idea of what that feels like. Okay, moving on to the next part of our activity. So again, in pairs, you can use the same partner or a different partner. Give just a quick 10-second massage. We're all massage therapists. We know how that works. Just quickly grab your partner's hand and give them just a quick little 10-second massage, and let your partner massage you after you work on them. And then again, practice your feed forward. We're looking for positive aspects of the mini massage, really good pressure, really good contact. How did it feel? And if there's parts missing, like you covered my whole hand, or you focused too much on my thenar eminence and you skipped my fingers, things like that. So you can give, again, a positive, something you did well, and something to think about for next time. Okay, now it's time for a quick discussion. I'd like to hear from everyone about how it felt going through the process of giving and receiving feed forward, and how it relates and compares to giving and receiving feedback. So we have this moment to reflect on what we've done, what we've learned, and whether or not we'll be able to, and how we can possibly incorporate these concepts into our day-to-day practice. And of course, also the learning process. I know for myself, in preparation for this module, I had a client who had the bad attitude just a few days ago, and I was trying to talk to her in positive terms about, you're doing really well, you're going through a tough time, I see that you're struggling. Maybe you should talk to your doctor about your depression. And also, I want you to know that the body is plastic and you can change things. I understand it's been difficult, but if you do the stretches and if you do the work, you should see results. So I know it's hard sometimes when you have that client that really believes that they can't get better. All we can do is support them and give them those encouraging thoughts and words, and in ourselves know that does work. I myself, I've been dealing with plantar fasciitis for the last year. I don't like to think about it. I don't like to overly obsess about it or describe it as being bad. But the fact is, it's been persistent. I don't give up. I keep doing the stretches. I keep doing the self-care. And I truly believe that the tissue will remodel and eventually I'll stop having that pain. So if I can share that energy, that idea of plasticity with the body to my clients, as a learner with my students, then I think that we'll all be a little bit more successful. So do take a moment and think about how you can use feed forward versus feedback in your practice and in your learning and teaching. Okay, so again, if this were real life, we would have had a nice little discussion, but here's our summary. You've learned about growth versus fixed mindset. You've learned about feedback versus feed forward and how it can be used both learning, teaching, and in massage therapy practice. And now is the time where if this were real, I'd be open to any and all questions. Again, if you're watching this and you want to give a comment, I'm super open to it. I'd love to hear from you. Thank you so much for following along, and I'm just going to click to the next slide. Thank you so much again, everyone, for following along. And here are some of my resources, mostly from Dwayne Harapnik's blog, and which are all coming basically from the PIDP 3351 course content. These blog posts have a lot of great resources within them as well for all about fixed versus growth mindset and feedback versus feed forward. I highly recommend it. Thanks again for watching my video.